Hi, everyone. Good morning. Welcome to the Kind Health Group podcast and YouTube channel. We have a very special guest today and a couple of our other friends in the studio helping us to interview. First off, Suzanne Wallach. Hi, Suzanne.
Hi, how are you?
Doing great. I'm going to have Angie Lake Castellanos, our Director of Operations, give you a proper introduction. Angie?
Hi, hello everyone. So today our special guest. So first I have to say she's a very good friend of mine. We've known each other for a very long time. But she has been in my life, and I know Money's just a really amazing person and great resource. It's Dr. Suzanne Wallach. So she is a EBT therapist up in Beverly Hills, and I'll kind of let her go into a little bit more details about what that is and her background.
Hi, everyone. My name is Dr. Suzanne Wallach. I have a master's degree and a doctorate in clinical psychology. I own a group practice up in Los Angeles where I specialize in working with borderline personality disorder, complex trauma, PTSD, and substance abuse. And in my practice, we primarily specialize in DBT. So DBT is a modality of therapy that was, that Marshall Linehan came up with about 25 years ago. It was originally formulated to deal with acutely suicidal patients and people with borderline personality disorder. What they've seen in the past 10 years is that because DBT was so effective at treating these really acute disorders, it's now being used sort of for a wide spectrum of things: depression, anxiety, OCD, ADHD, a lot of things like that, in addition to still treating suicidal and borderline personality disorders. So the quick explanation of DBT is it is a modality of therapy where we're teaching people how to change the reactions to their emotions. So what the hypothesis behind it, or what Linehan hypothesized, was that we can't really change the thoughts that come into our head, but we can change the way that we react to our thoughts. So if I'm angry about something, I don't have to react by yelling or lashing out at someone. There are skills that I can use: emotion regulation skills, distress tolerance skills, interpersonal effectiveness skills, and mindfulness skills to help me be able to sit and process through my emotion and then figure out a way to react that's not going to make the situation worse. So that's really what we're trying to do in DBT, is teach people how to be skillful and how to be more effective and to stop letting their emotions sort of rule their lives. Basically, how to be in control of your emotions instead of the other way around.
Great. That's a great description. Thank you.
That is, yeah. Well, and I can say too, I've been going through some of the skills myself, more so I've got a teenager in the household, and we've kind of got a mixed family. And so it was something that, in talking to Suzanne, again, is something she did recommend and say, hey, this might be really helpful, for you guys. And I can definitely say that now, looking back and being where we are today, I'm so thankful that, we've been going through a lot of that, because we've definitely learned a lot of different skills that even, just in a day-to-day basis are really helpful, but especially in a situation like this, it's really kind of helped us feel more grounded. And, one of the things that I know that we kind of go through, and I think it might be helpful for people out there right now, is kind of the check the facts skill. I know has been super helpful. And so, Suzanne, is there anything you can kind of say on that, just to kind of help people with some of the fears they're facing at the moment?
Yeah, so check the facts is a distress tolerance skill. It's actually one of my favorite skills, and you can use it for a lot of things. But I think right now, even, it's really good because there's so many, with what everyone's going through right now, I feel like there's just so many different things being said, right? There's press conferences every 2 minutes, and there's, things that are politicized, and there's rumors going around and a lot of fear mongering. And so the check the facts skill is kind of just what it sounds like. It's stopping and really checking the facts. So for example, if I'm afraid to go outside for a walk because I think that I might catch COVID-19 just from leaving my house, it's stopping and checking the facts, right? Well, what are the facts? There is this worldwide pandemic. We have been advised that it's okay to go outside. That is a fact. We have been advised to stay 6 feet away from people. That's a fact. Probably leaving the house just to go in my backyard is not something that's dangerous. So it's really just stopping and checking in, like, what's a fact and what's emotion. You know, what's real? And in DBT, what we're doing with facts is a fact is anything that can be proven by our five senses. So if I can see it, smell it, taste it, hear it, or feel it, it's a fact. If I can't back up my fact with any of those things, then it's not a fact, and I have to put it to the side, and I'm not using that to determine how I'm going to behave. So if it's not a fact that a doctor hasn't told me that going out in my backyard is dangerous and I need to stay inside 24 hours a day, I'm not going to use that to justify my behavior.
That's good advice.
Yeah, so, you know, if it's not a fact that people have told us we need to go like buy, you know, 30 rolls of toilet paper, we don't need to participate in that behavior, you know.
Yeah, another good
With kids, I mean, I know you treat kids as young as 6.
So my practice does. Personally, I don't work with kids younger than 13, but we do have comprehensive DBT for children in my practice. And so there are 2 therapists in my practice that work with children ages 6 to 12.
So what is your advice for kids right now? Because they are sort of shielded from the news and the facts, you know, by their parents on purpose. So what advice do you have for a kid who might be feeling really anxious or nervous or, you know, missing friends, routine?
Yeah. I mean, I think what we're sort of telling parents right now is to be honest with your kids. I mean, I think that there's, you know, there's value in being honest with your kids. Obviously, you know, you don't want to scare a 6-year-old, and there's a lot of things they don't have the capacity to understand, but also you want to be really honest with your kids about, you know, this is sort of a time where we're facing challenges, and these are the things that we need to do in order to stay safe. The same way that you would talk to them about how to safely do anything, you know, I think you want to sort of tread that line of like being honest with them without giving them too much information that they don't have the capacity to understand and overwhelming them. But I think it's really important right now to be honest with kids about what's going on and teach them how to be safe and teach them about keeping distances, about washing their hands, about, you know, what sorts of behaviors are appropriate to engage in right now. And then also I think being able to comfort them, because I do think that there are some kids, I mean, I know we've had some kids in our practice where they do know something's going on, you know, and they're scared. And so also I think reassuring them and letting them know that they're safe and that they're safe at home, they're safe with their parents, and that it's going to be okay, because I think it is going to be okay.
I think we all need to hear that it's going to be okay. I think everyone could use some comfort there.
Yeah, I think no matter what, I mean, it's not, and I don't need to minimize it, like it's all going to be okay, right? Because there's some bad things happening right now. And I also think that it's going to be okay.
That was going to be one of the, because that's probably one of my favorites is the "and" statement, you know, that 2 things can exist at the same time and they can actually really be total opposites.
Yeah, like so the definition of a dialectic and dialectical behavior therapy is that the 2 opposites, a dialectic is 2 opposites existing at the same time. So we're always trying to balance that it's not black or white. So, you know, things are really scary right now, and there's a lot of things that are still okay, you know, that both of those things are happening right now. And the work is to stay in the middle of both of those things and not get too far on one side or the other. You know, you don't want to pretend like everything's great right now, but we also don't want to be totally in the bad and just looking at everything that's catastrophic. We want to sort of stay in the middle.
Yeah. Yeah, so kind of jumping back to telemedicine. So I know, you know, we as a practice have converted over to telemedicine. I know you had it available as well before, but now are primarily, you know, seeing all your patients virtually. How is that going for patients? How is that going at home? I know you and your husband are working from home right now, and you guys also have a new little baby. So I'm sure that's exciting and challenging.
Talk about 2 opposites existing in one sentence.
It's more challenging than it is exciting. It's challenging, right? I mean, I think one thing that I just realized this week that I had never really thought about was how valuable being in a room with somebody is. Even if you're sitting, you know, 5 feet apart from them and they're on a couch and you're in a chair, there is just something about that human presence and that human interaction and just being in the room with somebody that you can't really replicate on video. So I think we're doing the best we can from my guest bedroom. And I think, you know, even for providers, it's this strange sort of, I've been curious about noticing even in myself of like, well, I'm working all day, but because I'm not leaving my house, I don't feel like I'm doing much, even though I might be working for 11 hours straight. There is something that I find really fulfilling about getting up and going to my office that's not there anymore. And I think there's something for the clients or for my patients about, you know, coming in and seeing me in person that's not there. So I think we're just doing the best that we can. I think it's obviously still effective, but I just, personally, I just miss the human contact. It's not the same through a screen. So it's been challenging.
That's a really good point. I'm intrigued about people who have addictions, right? So, you know, a lot of alcoholics will go to Alcoholics Anonymous, going to the meetings. You know, it's the community. How are you dealing with that virtually?
I mean, I just think we're doing the best that we can. I mean, in regards to the patients that I work with that are struggling with substance abuse, right? It's kind of the same thing. They're all attending online meetings right now because a lot of AA and NA meetings obviously have been canceled because of the crowd, you know, no crowds over 10 people. So I think everybody's just trying to do the best they can. I mean, that's something that I'm talking in a lot of my sessions about is like, how do we stay socially connected when we feel so isolated? And how do you stay socially connected even people who are in the house, you know, like I'm here with my husband and my baby and I still feel isolated. And so how do you still socially connect to people outside of the immediate people in your family? How do you still stay involved in your community somehow? I think it's really important as much as possible that we maintain connection in whatever sort of kind of meetings we were having before, even if they're online now. So that's why I've tried to tell people it's important to keep going to AA. It's important to stay in therapy. It's important to work virtually, to try to maintain as much normalcy as possible. Because it's really important. I think it's very easy to fall into feeling isolated, and that breeds anxiety and depression. And so we really want to fight that.
Well, it's interesting what you said too about people having extra time and maybe, you know, shopping online or gambling online. Have you noticed, I know you work with people who have eating disorders. I mean, people are home, they're in more of a fearful state, maybe they're overeating or undereating. Can you talk a little bit about that?
Yeah, so eating has become actually a really big topic. Food has become a really big topic in a lot of my sessions these past 2 weeks, because I don't think, it's not even just people with disordered eating. It's, you know, it's just really easy right now to sort of like, I feel like when you're already being deprived, right, of the outside world and you're being deprived of going to work, it feels not great to deprive yourself of carbs or of sweets. And also, right, those are comfort foods and they help us feel better. They hit the reward center in our brain and we release a bunch of dopamine and we feel better for a little while. So I think, you know, I'm kind of encouraging people right now to sort of give yourself a break. Like if you want to, you know, indulge, but do it mindfully, right? So do it in a way that is healthy. Like we don't want to be binging on a bunch of like bad foods and things like that, because then we don't feel good and health-wise that affects us. So again, it's trying to figure out how to walk the middle path. I think that's something a lot of people are struggling with because, like I said, when you're already feeling deprived, you know, if you want a cupcake, you want a cupcake, you know? So I think, but for people
yes, nodding my head, yes, I want the cupcake.
Yeah, for people who I'm working with that are struggling with eating disorders, it's challenging too, right? Because like they're trying to follow food plans and they're trying to monitor their foods. And also it's not that easy right now at the grocery store to be able to go and get the things that you need in order to follow some food plans. And so that's been really challenging and also causes a lot of anxiety for people. Or you have the opposite end where people have started like binging and indulging in things that they know they shouldn't, and that can set off a whole variety of behaviors in eating disorders that we want to avoid. So again, it's just trying to keep people engaged with therapy, engaged with their dietitians, mindful of their food plans, mindful of what's going on. And also exercise, I feel like, is really important too right now. So trying to keep people involved in that.
Yeah.
What have you been doing for, what have you found useful for exercise for yourself?
Well, I was hiking until this weekend when they put a moratorium on hiking in LA because there were hundreds of people out on the trails, not social distancing. So, I mean, I take my daughter on long walks twice a day. I broke down and ordered a Peloton bike last week because I figured I was stuck at home. I was finally going to get that Peloton. And then running on the treadmill. I've started running outside again as much as I can if I have time. Or even just like downloading yoga classes and making sure. One thing I've put into practice just the past 2 weeks, just from being in ballet for my whole life, is I'm stretching now in the morning and stretching at night for like 5 to 10 minutes just to make sure that I'm staying limber and that I'm having sort of a mindfulness activity in the morning and before I go to bed. So those are the things that I'm doing. But I've talked to a lot of people who are actually like Zooming with their personal trainers, or they're Zooming Pilates classes. And I think it's just really important to keep doing whatever you were doing before in whatever way you can.
Yeah, so that kind of, that kind of brings up that topic about, we're missing the outside of our homes, right? And kind of all the validation that we were getting from going to classes, hearing from instructors, oh, good job, or correcting, things like that. I know that's been something I really realized this week. I never thought I was someone who needed much attention or validation, but not going into the office every day where, it's usually like, oh, Angie's here. Like, oh, what is she wearing? And then now there's my list of like 10 problems and please fix. We're so happy you're here to help. And that's not happening right now. So
everyone else is wondering what you're wearing. I'm just grateful you're there and you can help manage the ship.
I'm wearing something that she copied out of my closet.
I'm sure.
Probably,
yes.
We share many things.
Angie's a no repeat outfit wear. True.
But yeah, so it's like the validation thing, right? And I mean, we can get it at home, but I think I'm realizing how important it is also from your friends, your coworkers, just people in general. I mean, just seeing someone smile when, that's been something when I have had to go out and go to the store, I have been making sure to like still at least smile at people because I feel like, everyone's kind of in their own zone, and I see people that, I don't disagree with the gloves and masks, being seen in public, but it just creates kind of this like, don't look at me, don't talk to me, don't validate me, don't anything. So what are some, I guess, and there's like it's a double-edged sword too, right? It's validation is good and we can seek it in the wrong ways.
Right.
Kind of worry about like the social media and, just what are some healthy ways to still maybe get validation externally? And then what are maybe some things that we should try to avoid?
So, I mean, I don't think external validation is actually a great thing to depend on. And that's actually one thing in DBT we're really trying to break people out of is like external validation obviously feels really good and it's great if you get it. But what we really focus on in the mindfulness aspect of DBT is being able to like internally validate ourselves and internally take care of ourselves and internally parent ourselves, right? Because validation starts with humans from a very young age where ideally you're getting it from parents that are mirroring you and validating you. So right now, I mean, I sort of think it's like you said, right? We try to stay socially connected to people. I mean, I'm definitely trying to look people in the eye and say hello and smile when I go outside because it just feels good to like, even if I'm just walking by someone on the sidewalk, it feels good to connect that way. But I think, maybe one of the silver linings of what's happening right now is it's really forcing everyone to sit with themselves. And I think it's also figuring out, well, how can you do things that feel good for yourself so that you can internally validate and you can feel good about the fact that you ran a couple miles today or that you talked to your mom who's across the country, or how can you create sort of like a coping plan for yourself so that you can still be doing things that you get fulfillment out of and so that you can feel internally fulfilled and validated, I think is more important right now. And I actually think it's like one of the good things because this is a really great opportunity for people to start practicing that because external validation has really been taken away from us, especially for people who are living alone. You don't have other people in the house.
Yeah, that's very true. Yeah.
I definitely been spending a lot more time cooking, and I didn't realize how much I depended on eating out. And then when I can cook something, from beginning to end, follow the recipe, it comes out great and everyone's happy. amazing feeling, something that I know how to do, I just haven't had the time to do. Have you been talking to patients a lot about sort of what they've discovered they had within them that they just let go because we were all dependent on drive through Starbucks or, you know, drive through dinner?
I mean, cooking is a big one. I think people are discovering. I've talked to a lot of people who are trying like different sorts of exercises, like doing Instagram live classes in, you know, maybe like I was talking to someone who decided to take like a tap class. Like, you know, she didn't even have tap shoes, but she was like, I'm just going to take it, you know, Instagram live. I've had a couple clients who were like, you know, I've always wanted to learn Italian. So I decided this was a great time to just start like learning a language or to get to those books that I haven't had a chance to get to. And I think, you know, it's just trying to figure out, I'm not necessarily a fan of the concept of gratefulness because sometimes I think it can make people feel like there's something wrong with them if they're not grateful, but just trying to find some of the value in some of the things we're being forced to do right now, right? Like I don't really like working from home, but I do love the fact that between sessions I can see my daughter and go see her for 2 minutes, like multiple times a day, and that, you know, I'm here. Yesterday she fell down and hurt herself and I was in the house and I was able to be there for her instead of coming home after work and seeing her with, you know, a bruise on her face and stuff like that. So I think everybody is sort of finding different things that they can implement and that, you know, that we can be sort of like grateful to have the opportunity to do right now. But those are some of the ideas I thought. I loved the idea of sitting down and learning a new language that one of my patients came up with, where she wanted to take Italian for like 5 years and just had never gotten around to it. And so she's finding a lot of fulfillment out of doing those online classes right now.
How are you feeling dealing with an uptake in patients and working longer? I mean, granted, you're working from home, but are you sort of de-stressing in between? How are you handling it? Because it is a lot of, you know, the same fears, patient after patient.
Yeah, it's, so how do I de-stress? Well, I mean, I definitely have time between patients. I think what I try to do is I just try to pay attention to like my vulnerabilities, right? So am I physically vulnerable? Am I eating balanced? Am I sleeping enough? Am I exercising? Because I think that that's like really the baseline for everything in regards to mental health. And it's called the please skill in DBT that we teach people, you know, like check in with your physical vulnerabilities first and then go from there. So I definitely try to take care of those first. I mean, spending time with my daughter really helps me. And as far as de-stress, I mean, really for me, it's sometimes just after doing 10, 11 sessions a day, just putting my phone away for a couple hours and just trying to be present and in the moment. People are, you know, a lot of people are in kind of a dark place right now. People are struggling. And so there are times at the end of the day where I feel the weight of that. And I feel like, wow, I just had, you know, 8, 9 sessions straight with people who are really, really having a hard time right now. And so I just try to take care of myself the best I can and focus on, you know, the stuff that's important to me and also take a step back and kind of separate myself from my work a little bit at the end of the day.
That's amazing. Thank you for doing it.
Yeah. Well, I think that's, you know, a lot of the mindfulness, and I'm noticing, you know, we rely a lot on mindfulness in our practice. You know, that's something that Annie, health coaching patients, you know, is a big thing. And we're definitely talking about it. You know I've recently started kind of incorporating it into our staff meetings and everyone's really enjoying it. Dylan, he came and showed me some messaging that he got from his high school, you know, just their updates, and they're doing a daily mindfulness, you know, video with all of the students. So I think that's, you know, one thing that a lot of people, that's a skill that we can all use regardless of whether we're in therapy or not, or, you know, and maybe if you could just share some different ways, you or Annie, I mean, you guys are both, I think, really experts on the mindfulness piece, but yeah, maybe we could just kind of talk about some things we can do at home to help us stay kind of present and in the moment.
Well, I think Suzanne touched on it when, you know, getting out and moving is so important. I mean, this past week we had rain and it was really tough. I mean, not to be able to get outside. So, and I know the beaches are closed now, as you said, the trails. So it's definitely just about getting out there and moving. as much as possible, getting in the sunlight. Breathing, sleep is really important right now. And I know it's really hard if you're home all day long, sort of just switch back and you're in comfy clothes to begin with, then to switch into pajamas, then to go to, I mean, the times are, you're sort of losing track of time. So I honestly, when I talk to people, I talk a lot about scheduling, scheduling your day, getting movement in, you know, having time to find joy in something, whether it's cooking or painting or learning a new language. So the days are long right now.
They definitely are. And I think, yeah, the best advice that I got from a psychiatrist that I work with was kind of what you were saying, is like, it's really important that we stick to the same schedule we had before this. And so I think like it can get really easy. I've had mornings where I'm like, you know, my patients don't care. I can just stay in my sweats. And like, as long as I throw a little makeup on my face. And I was talking to a psychiatrist that I work with about this, and he was saying to me, it's really important that you get up and you get in the shower and you get in your work clothes and you have your coffee and you stick with like, you know, your normal routine, that you're not sleeping later than usual, and that, you know, that you're doing everything the way that you were doing it before to try and keep it as normal as possible, because it can get really easy. That's why I'm even trying to sit, like, this is the chair that I have in my office. I had my husband bring it home for me. And instead of like sitting on the bed in my guest bedroom and doing sessions, I'm really trying to kind of keep things the same as possible. And then in regards to mindfulness skills, Angie, the one that was coming to my mind from DBT is radical acceptance, which I think is like a core DBT skill, and it's a core DBT mindfulness skill that we teach. And the thing that I love about the concept of acceptance in DBT is radical acceptance is not about being okay with any situation. It's not about like, okay, I'm fine with this, I accept it. It's really just acknowledging the truth of what's happening and not being in denial. So, you know, we're in a really scary, bad situation right now. And as long as I can accept that, I can then figure out how to respond to it, right? So responding to it by crawling into bed and staying there for 3 days probably is going to make the situation worse. So it's really just figuring out, like, how can I be in acceptance of what's going on right now and not in denial? Meaning, like, you know, I don't want to be in denial and be one of those people on the beach partying or going out and, you know, like having game night and having 15 people over to my house, right? But if I can accept, okay, well, here's what's happening in the world right now, then I can figure out like, well, what's the appropriate response? What do I need to do? You know, I need to keep a schedule. I need to do this. But I think radical acceptance is something, at least for me, that I'm having to do multiple times a day, because I do find myself sliding in and out of like, it's fine. Everything's fine. It's no big deal. I can go run errands. It's not going to be that big of a deal. And then having to be like, wait, it's not that simple. You know, this is what's happening right now. Let me just sort of like go back into accepting what's going on and how things have changed.
That's really good advice. Any other questions so far? I mean, I know obviously that there's, you know, people in crisis right now, you know, that's still happening. That's one of the things I think about is, yes, we're in this time and it's affected a lot of us, you know, and life is still happening in terms of, you know, still people coming to terms with addiction, maybe reaching their bottom, you know, realizing I really need help. Maybe this time kind of like brings that to the surface faster. You know, obviously there's a lot of other things that I really try not to think about too much, you know, because I think about, you know, children that are at home that aren't getting to kind of escape maybe certain things that they used to be able to escape when they went to school, you know, for 8 hours a day. And, you know, there are a lot of challenges, obviously with this situation, you know, but still also that kind of regular life and the things that we were seeing before are still happening and going on. You know, if people are kind of in crisis and they need to reach out, I mean, you're up in LA, I'm sure you've got some kind of like resources up there, and we'll definitely include, you know, the resources that we have in San Diego for crisis kind of intervention. But what do you say to maybe some of those people that are going through that, and, you know, what can you recommend?
I mean, I think if people are struggling, it's, you know, ask for help, right? I mean, it doesn't have to necessarily be therapy. It could just be, you know, I mean, we mentioned AA earlier. It could be health coaching. It could be just reaching out to a friend and saying, oh my gosh, can we please get on FaceTime tonight? I'm feeling so isolated. I just need to talk to another person. I think that this is a time where, you know, it's like we're isolated and we really need each other. And so I think the most important thing for humans is just connection and attunement all the time. And I mean, I would encourage people, if you really are struggling, to reach out to a professional. But also I just think that, hi Dylan. I also just think that, that in addition to reaching out to professionals, I mean, there is something to just connecting to people. And I also really have found myself discouraging people from feeling like they don't want to bother people. You know, I think that's something I've heard is like, I don't want to bother you. I don't want to bother my sister. She's got her kids, or I know you have your baby and I don't want to reach out to you between sessions. And I think everybody right now wants to help and wants to be available for other people. And I think people are more willing than you think they are. Also, everybody's cooped up. And so I think people are willing to get on FaceTime. I think the main solution is not to isolate, you know, not to give into your emotions or let your emotions keep you from asking for help or getting the help that you need.
I think that's really excellent advice. All of your advice has been outstanding, Suzanne.
Oh, thank you.
Anyone else have any other questions? Thank you so much. Thanks for your time today. I know how incredibly busy you've been. I'm sorry, what was that?
I said thank you. I appreciate it.
It was awesome to have you. So we're going to sign off, and we'll have your information in our podcast notes. But if you wanted to schedule with Suzanne, her website is SuzanneWallachMFT.com. Is that correct?
SuzanneWallach.com.
SuzanneWallach.com, sorry.
That's okay.
But we'll have that in there as well. And kindhealthgroup.com, we're also scheduling virtual appointments for patients. And we are here for you. We know how incredibly difficult this time is. So please reach out to any of us. And like Suzanne said, just even friends, family, it's important to really stay connected. Thank you, everyone. Have a great day.
Thanks, everyone.
Thank you.
Bye.